Senators Michael Bennet and Cory Booker have introduced the Black Maternal Momnibus Act of 2021 in the United States Senate. The bill would address Black maternal health disparities by driving investments into social determinants of health, community health, and health equity data collection. Joining me now to discuss this is Jesse Thompson, nutritionist and founder of the DetoxNow.com, Charles Johnson, founder for Cure for Moms, and Errol Pierre, Senior Vice President of State Programs for Health First. All right, folks, first and foremost, how will this, if this is passed, what will be the impact for mothers? What will it mean for their families? Errol?
Sure. I think this is very important legislation because right now what people face is not enough care. We know it disproportionately impacts Black and brown mothers. The panel stated, Jesse talked about it. If you filled up a stadium with 100,000 Black women, 40 of them, if they became pregnant, would die. It's only 12 for white women. And you might say, well, we need to reduce that disparity so that it's not so much with Black women. But even in other countries, they have higher quality, lower mortality rates. Japan, it's only 5 women. And in countries like Spain and Europe, it's lower. So fixing this issue for Black women will actually fix it for the whole country. And another piece that was brought up was the importance around something we call ethnic concordance. And if we can get more Black doctors into the healthcare system, we actually have bona fide research that shows the outcomes are better. And it's because those Black doctors have empathy. One of the big issues that happens in the delivery room is if a Black woman says, hey, on a scale from 1 to 10, my pain is at a 10, I'm in excruciating pain, they're not believed. And sometimes they're not believed because there's this implicit bias that's endemic in the system that says, well, she's a Black woman, her skin might be tough, she's maybe big bone, she's tough, she's a strong Black woman, she's not in pain. And the dollars in this bill goes to research, so we have more data to uncover these implicit biases. It goes to making sure that people are educated. It goes to making sure that doctors are educated on their implicit bias. There was a study about a hospital in Philadelphia that found 95% of their residents had a negative bias towards Black patients. So imagine you walk into a doctor's room and the doctor already assumes you're not going to listen to them, already assumes education attainment about you, already assumes negative connotations about your diet. How do you think you're going to feel? You're not going to open up. Those conversations won't go well, and the health is poor. So we're really looking forward to the outcomes of all this legislation, because it'll not only have Black women living longer, Black babies living longer, but it'll also reduce healthcare. We spend twice as much as any other country, and we don't get the quality that we deserve.